CMS redid the 2026 star ratings. And for any plan that came out at 5 stars because of it, it creates an SEP in the middle of the year. So stay with me, because every week I break down the headlines that are moving our industry, and then I bring you a quick and beautiful summary right here. So buckle up for story number 1. UnitedHealth Group. They filed its second quarter 10Q, and their MA membership is down 785,000 members since last year. They say that funding continues to be pressured and that it's the benefit and pricing actions that are causing contractions in their MA membership. So basically, they trimmed benefits, priced up, members left, and they're telling investors to expect more of it this year. Now, 3 things are squeezing every carrier at once here. The V28 risk adjustment model, taking risk scores credit away from a long list of diagnosis codes. CMS gave Medicare Advantage an average raise of 2.48% for 2027. And people are still using a lot of care. Now, on 2027, UnitedHealthcare's early plan drops Medicare Advantage in 34 counties across 12 states for roughly 20,000 members. And in 3 of those counties, UHC is the only MA carrier. Ouch. Story number 2. KFF published the first look at prior authorization numbers that insurers now have to report in public. It covered what 14 different insurers did in 2025. So in Medicare Advantage, plans said no to 12% of standard prior authorization requests. For comparison, Medicaid managed care plans said no to 14%, and marketplace plans said no to 18%. Now, the number to remember is this one, though. 67% of the Medicare Advantage denials that got appealed were overturned. In Medicaid managed care, it was 47%, and on the marketplace, it was 43%. So basically, in MA, 2 out of every 3 appealed denials came back approved. On standard request, it ran from 5% at Elevance up to 17% at UnitedHealthcare. Now, this data is easy to use badly, so keep in mind 2 things. Number 1, a 12% denial rate is not 12% of care, overall care, getting refused. It's 12% of the requests, and most of those clearly can be appealed. Number 2, please remember that these are 2025 numbers that carriers reported. Now, story number 3. Clover Health took CMS to court over the star ratings and won. So CMS went back and did the 2026 star ratings over again for every plan. And those are the ratings that set the bonus payments for 2027. CMS only revised the ratings that went up, though. So a very important thing here is that when a redone rating comes out at 5 stars, a new 5-star SEP applies. So who knows, there may be an enrollment path in your service area. Now, the rating also moves the money that pays for extra benefit. So a contract at 4.5 stars or higher keeps 70% of the gap between its bid and the benchmark. One between 3.5 to 4.5 stars keeps 65%, and anything below 3.5 keeps 50%. So the carriers that gained the most from the redo were United, then Clover, Blue Cross Blue Shield of Alabama, then Humana, and then CVS. Now, 2 things that you must know. CMS has appealed, so a rating that went up could get pulled back down in court. And the rating increases are contract by contract, not carrier by carrier. So a carrier showing up on that list does not mean that every single one of its contracts moved. So before you use a 5-star SEP, look up the specific contract number and confirm the rating, not the carrier name. That's the step that I honestly would not miss at all. So My friend, this is your update for this week. But for the complete news report for this week, because there were a lot more stories, go check out my newsletter and subscribe for free.